Conference is being recorded. If you have any objections, you may disconnect at this time. All participants are in a listen-only mode until the question and answer session at the end of today's presentation. To ask a question at that time, please press star one, unmute your phone, and clearly state your name for question introduction. I would like to now introduce our host, Captain Francine Barnett. Captain Barnett, you may begin.
Good afternoon, officers. I'm Captain Barnett and the acting DCPS liaison. I want to thank you for taking time out of your schedules to connect with us today. I'd like to introduce our guest speaker, Rear Admiral Mark Calkins, Director for the Division of Sanitation Facilities Construction. Admiral Calkins.
Thank you, Captain Barnett. Good afternoon, everyone, and thank you for taking the time out of your busy work schedule to join the call today. I'll just say that the Division of Commission Personnel Support puts a lot of effort into organizing these calls, and it is a good way to demonstrate our support and appreciation for their efforts by taking the time to participate. So, again, thanks for being on the call. I want to bring to your attention to the fact that starting tomorrow, May 6th through May 12th, is National Nurses Week. And during this time, it is important that we recognize the contributions that our nurse category makes to our federal and tribal communities on a regular basis. And certainly since the start of the pandemic, our nurses have sacrificed and dedicated many hours of service, and we would like to thank them for their work ethic, leadership, service, and professionalism that they have exhibited on a daily basis as they serve the Native American population. As you all know, the Indian Health Service remains engaged at all program levels in addressing the pandemic. IHS leadership continues to support the incident command structure to monitor the progress being made and challenges confronted on a daily basis as it relates to the pandemic and the administration of the vaccines. The Indian Health Service units staff across the country have gone above and beyond in those efforts to address the COVID-19 outbreak and the administration of the vaccines. And as a result of their efforts, when we look at the Indian Health Service as a whole, the 7-day positivity rate is 3.5%, which is below the U.S. all races rate of 4.5%. Although substantial progress has been made, we occasionally see the 7-day rolling average positivity rate in some areas creep up past 5%. It is IHS's goal to keep this rate well below 5%, which is classified as low transmission. So it is important that we keep our guard up and do our part as Commission Corps officers in support of the Indian Health Service mission. Lastly, I'd like to provide an update on the unaccompanied children mission. As of April 26th, there are 22,103 unaccompanied children assigned to approximately 200 state licensed facilities and programs in 22 states throughout the United States. The U.S. Public Health Service Commission Corps officers have been called to serve, and the officers assigned to the Indian Health Service have answered that call. The IHS put forth 237 names of officers to be called to serve if needed. These officers are those that were not listed as mission critical and as such are eligible for deployment. As of today, we currently have 54 officers serving in 5 different states, and 40 officers have been demobilized from the deployment mission since the start. Many of you may have received an activation notice several weeks ago and have not received any updates. Since this mission is a moving target, I encourage each of you to remain patient and ready to serve if called. It is my understanding that the department is actively engaged in bringing in contractors to take over the various sites, and as this occurs, we will likely see more officers being demobilized. In closing, I'd like to thank you for your service and commitment to the Indian Health Service mission, and to let you know that the Indian Health Service leadership, along with DCPS, is committed to sharing as much information with our officers as it becomes available. With that, I will end my comments and turn this over to Ms. Davidson. Thank you.
Thank you, Admiral Calkins, for your comments, and I appreciate your willingness to be our guest speaker today. Welcome, Commission officers, to the May 2021 All Hands Call. The topics we'd like to go over today are the Commission Core updates. We'd like to address waivers, both medical and deployment, telework agreements. We will go through past questions that were submitted from the last live question and answers. For our Commission Core updates, go ahead, next slide, ma'am. All right. Continuous evaluation program. So Commission Core officers are considered occupying a national security position. Based upon that consideration, officers are enrolled into the Continuous Evaluation Program, also known as the Trusted Workforce 1.25. This is part of the ongoing routine evaluations conducted for public health service officers to retain their national security positions and potentially the access to classified information. Public health service officers should refer to Commission Core Instruction 231.04, National Security and Suitability Background Investigations, and their associated frequently asked questions, documenting any further information. The Office of the Inspector General may provide inquiries to be requested of officers that were currently deployed in conjunction with the Unaccompanied Children mission. Officers must comply with the Office of the Inspector General requests related to the deployment and need to respond via the agency through which they are deployed. The 2021 Chief Professional Officer call for nominations have been gone out, and they have been disseminated for applications in the following categories: dietitian, environmental health, engineering, medical, and scientist. For our officers, please remind your leave approving official to access eCore to approve or disapprove your leave and confirmation requests. Currently, Indian Health Service has over 1,400 leave submissions that currently are not accounted for. Next slide. 3 new policies were released on 1 April 2021 regarding assignment pay. Assignment pay is provided and paid monthly to certain specialties and is meant to help locations with high vacancy rates to fill critical needs. Although paid monthly, officers must enter into a 2-, 3-, or 4-year agreement. In order for a location to qualify for assignment pay, the location must be designated as an isolated hardship site and have a 2-year vacancy rate above 15%, or the location must have a 2-year average vacancy rate above 30% for a critical need category. We are still getting clarification more on this program and information regarding it, and hope to have more information to share in the near future with you. The summer white uniform is now authorized for wear. As a reminder, the National Uniform Authority has requested that all Commission Corps officers wear their ODU uniform until further notice as we continue to respond to the COVID-19 outbreak. Summer weights may be authorized by your local uniform authority for special situations such as attending or presenting at a conference. And lastly, on Unaccompanied Children Program. On March 25th, 2021, Health and Human Services Secretary Xavier Becerra alerted all HHS employees of the urgent need for volunteers to assist with the Unaccompanied Children's Program. IHS is supporting this mission, and many IHS officers have already deployed. The names and information of hundreds more have been submitted to CCHQ for possible deployment. We will continue to work closely with area directors, IHS leadership, and Commission Corps headquarters to support this mission while all balancing the needs and staffing of IHS. As we receive further guidance concerning the Unaccompanied Children Program, we most certainly will provide any updates to our officers. And lastly, the Commission Corps headquarters have reintroduced the Commission Corps Bulletin. This bulletin was first established in the early 1980s, and now the new revamped bulletin will serve as a way for Commission Corps headquarters to communicate important information, updates deadlines, and reminders to officers on a monthly basis. The Commission Corps Bulletin will be distributed through the Commission Corps listserv on the first Monday of each month and can also be found in CCMIS website. I will go ahead and pass it over to Commander Dotson-Frink. Sir, the floor is yours.
Thank you, ma'am. On July 3rd, 2003, the Secretary of Health and Human Services recognized the Corps' unique status to provide swift and effective response to urgent health needs and directed that all active duty officers meet force readiness standards. This recognition highlights the Corps' ability to meet the urgent and extraordinary public health needs of the American people while continuing to perform in traditional mission areas that are focused on protecting, promoting, and advancing the health and safety of the nation. To accomplish these critical missions, it is imperative that the department has a fit and healthy force of officers ready to respond, protected from disease and injury when and where the department's mission requires. There are times when officers may require time-limited or permanent medical waivers due to medical conditions that affect their health status or personal well-being. Such conditions may pose specific or general physical limitations or restrictions on their ability to reach optimal force readiness. Therefore, officers may be medically exempt from meeting one or more of the standards required for the basic level of force readiness with a valid medical reason exists. To achieve this, the medical waiver program was created. So the purpose of the medical waiver program is to assist the Corps in implementing the department's policy on medical and force readiness while reducing the intentional injuries due to inappropriate application of an immunization or physical readiness requirement per Commission Corps Instructions 221.02, medical readiness. Next slide. There are two types of medical waivers. You have the permanent medical waivers. So permanent long-term renewable medical waivers may be granted for conditions that are usually unlikely to improve in the foreseeable future, but do not prevent an officer from performing for more than 2 years, the cardiorespiratory endurance section of the PFT, or from being deployed. Two examples of this waiver are immunizations, which are in contraindicated individuals with severe egg allergies, or beard waivers for certain skin conditions. Before I go into the second type of waiver, I'd like to bring your attention to the phrase more than 2 years. For policy CCI 221.01, any officer who, because of a documented medical condition, cannot be deployed or who cannot complete any of the cardiorespiratory endurance exercises of the APFT for 24 consecutive months is not eligible for a medical waiver and must be referred to medical affairs to review by a medical review board. So next we have the time-limited medical waivers. Their temporarily time-limited medical waivers may be granted for a documented health condition that is likely to improve within 12 months or less from the date that the request was received by medical affairs. So as soon as you find out that your medical condition has changed or will change, notify medical affairs. For example, if you're scheduled for some type of medical procedure, or for female officers, when you find out that you are pregnant, make medical affairs know. These are examples of time-limited waivers. Next slide. So medical waivers. So medical waivers are personal exemptions from performing or engaging in one or more of the following. And I'll come back to them, but I'm going to go through them. So deployment, receiving one or more immunization, performance of all or part of the APFT, meeting weight standards, maintaining uniform requirements, completing basic life support training, fulfilling other requirements necessary for meeting or maintain the basic level of force readiness. So go back to deployments. So deployment. If you are asking for a waiver for deployment, medical affairs will notify RDB, which temporarily waives you from being deployed. If you were to ask for receiving one or more immunization, this which waives requirements for specific immunizations based on allergies, medical conditions, or history of adverse reactions to a specific vaccine. Performance of all or part of the APFT, the strength, the flexibility, and the cardio. If you can only do one or the other or all, you would highlight that and check that for that request to be waived. Median weight standards. So which waives requirements to meet core retention weight standards as we are aware. So some medical conditions of treatment can contribute to change in weight or difficulty gaining or losing weight. When an officer requires a weight standards waiver, his or her health care provider must provide to medical affairs evidence-based data regarding the effects of the condition or treatment on weight. Officers must also provide a pre-treatment weight. If a waiver is granted, the extent of relaxing the standards will be based on documented effects of the treatment. Medical affairs will utilize peer-reviewed medical literature to determine the effects of a treatment. The next one was maintaining uniform requirements. So the beard waiver. This waives the requirement that male officers must be clean-shaven. However, officers must meet beard specification of the grooming waiver. Shoe waiver waives the requirement for wearing only authorized footwear, but it must meet the shoe specification described in the footwear waiver. Completing basic life support training temporarily. So this waives the requirement to complete a BLS. For my female officers, the pregnancy waiver, just FYI, no longer includes a waiver for basic life support certification. If an officer knows that her BLS certification will expire during the period covered by the pregnancy waiver, she should arrange to renew her certification early in her pregnancy or after delivery. However, pregnancy waivers automatically do cover exemptions for deployment, all sections of APFT, weight standards, and obtaining live virus vaccinations. And lastly, again, fulfilling other requirements necessary for meeting and maintaining the basic level of force readiness. Next slide. As I mentioned earlier, medical affairs makes RDB aware if you're able to deploy or not. They do this internally without disclosing protected health information by placing officers into 4 medical readiness categories. First one being fully deployable. Second one meaning deployable with limitations or specific needs. This is usually tied to documentation submitted with the medical waiver request. For example, if an officer needs a reliable source of electricity to operate a medical device and request a deployment waiver. Medical affairs branch may assign the officer an MRC2 requiring reliable electricity. RDB is now obligated to ensure that that officer's need is met wherever the officer is deployed. Category 3 is non-deployable. And lastly, Category 4 is critical information pending, currently non-deployable. Unfortunately, you can't see your assigned MRC on your readiness dashboard yet, but that is pending. That's pending right now, and hopefully that's be on the site soon. Next slide. So how do I request the medical waivers? So you'll fill out the active duty and reserve corps medical waiver request form. You'll clearly state specific waiver category requested on the form. This form can be found on CCMS webpage, either on the medical waiver program page or on the forms page under medical. What you'll do then is submit the waiver request form along with required signed medical documentation from your provider, which will specify your medical condition and diagnosis that justifies the waiver request, estimate and justify the period of time you require the waiver, and estimate when you'll be able to perform the waived requirement. So submit both the waiver request form and your medical document as one PDF. Again, one PDF. You'll group it together. You'll send it through eDocu in your officer care area. Upload the documents in the medical category as request for medical waiver. Next slide. Officers will not be sent the confirmation of the granting of a waiver, but you can review your waiver status by going into your readiness self-service page, selecting readiness information, and then clicking on waiver tab. And you'll see it in there when it was executed and received, and also you'll see a date when it's set to expire. If Medical Affairs has more questions, they will reach out to you if they need more documentation. Next slide. So in summary, for Commissioner Court Directive 111.03 conditions of service, This is just a reminder that all officers are required to promptly inform medical affairs of any significant new medical mental health diagnosis which could potentially affect their long-term health status, not likely to resolve within 1 year. That any officer who, because of documented medical condition, cannot be deployed or who cannot complete any of the cardiorespiratory endurance exercises of the APFT for 24 consecutive months is not eligible for medical labor and must be referred to medical affairs for review by a medical review board, and that approval of medical labor requests is not guaranteed. Medical affairs have sole discretion of approval and time limitations all medical waivers. And that lastly, all officers are responsible for adhering to the guidelines established in Commission Court Instructions 221.02 readiness. Next slide. And if you'd like more information on the medical waiver program, please go to their page. You can find that under CCMIS. Top here is the link. Also, too, if you have questions related to the waiver, you can contact your liaison. They can give you a brief oversight and summary how to submit it. But if you have medical questions specifically, contact Medical Affairs or even Core Care. Now we'll hand it over to Captain Verdugo for telework agreements. Thank you.
Thank you, Commander Frank. Good morning, good afternoon, everyone. I have the opportunity to share with everyone an overview of telework agreements. In our current posture, the federal government is maximizing telework to a great extent, and many officers may find themselves participating in telework or engaging in discussions with their supervisor to consider teleworking that may not have occurred in the past. So I'll give everyone a brief overview of telework in general and end with the specific process for how officers go about completing a telework agreement so that they can begin teleworking. So to give some historical context, the authority to telework really stems back to the Telework Enhancement Act that was signed into law by President Barack Obama in December of 2010. And that act required each agency to establish a policy and to describe conditions in which eligible employees are authorized to telework. So in this slide, you'll see that the governing policy that applies to Commission Corps officers and their telework really starts with the Department of Health and Human Services Office of Human Resources Instruction 990-1.2 Telework Policy, Commission Corps Instruction 313.01 Telework, and the Indian Health Manual Part 7, Chapter 6 Telework Agreement Program. Now, I will say that for those of you that take the time to review the governing policies, in particular, those that take a look at the Indian Health Manual, you'll find references to additional forms and documents that are required. And so I just will put this point of clarification in that at the present time, there is a single telework agreement form that officers must complete. And we'll discuss that later on. But not all of the forms that are referenced within the Indian Health Manual applies to officers. And as always, please reach out to the Division of Commission Personnel Support through your servicing regional liaison team with specific questions. CCHQ has put out a telework frequently asked question guide that's available on CCMIS. And there are approved sources of telework training that are published out there, and officers and their supervisors are required to complete that training. So you can find the training on the IHS Learning Management System as well as the OPM's telework.gov page. We've listed those there. Next slide. Okay, so what is telework? Well, essentially, telework is the performance of official duties at an alternate work site geographically convenient to the officer on either a regular or an episodic basis. So it is possible for officers to be teleworking regularly, and regularly can mean, in some limited cases, full-time telework. It could also mean on a regular frequency, such as some officers may work every Monday, Wednesday, Friday in the office, and every Tuesday, Thursday, they may be teleworking from the alternate work site. An episodic basis would be teleworking under certain conditions or for certain purposes, and many officers that are currently teleworking as a result of the pandemic are doing so under that conditional basis. Because of the pandemic, they may be teleworking. But really, the application of whether it's regular or episodic really does boil down to the officer's specific situation. Now, telework does not include work done that's on official travel or mobile work. So official travel, I think that's self-explanatory. Related to mobile work, this is really referring to if you have a position that involves you doing perhaps site visits. If doing site visits or inspections is a normal part of your job, then that would be considered mobile work, and you're not teleworking in that situation because the sites in which you're doing site visits at are not alternate work sites. Now, it's important for us as officers to remember that telework is a benefit, not an entitlement. And telework may be authorized to the extent that it facilitates mission objectives being met and staying met. So who's eligible? Well, first we have to think about the duties of the officer. And are the duties portable, and can they be overseen by the supervisory chain at the officer's alternate work site? Additionally, there are officer-specific criteria for eligibility, such as the officer can't have any pending or current adverse actions. They can't have violated any of the standards of employee conduct of the executive branch, cannot have be issued an AWOL and for an entire year following the issuance of an AWOL or being charged with AWOL, nor have any time attendance and attendance issues. They have to be basic ready, and officers cannot have any security issues such as history of misuse of information / IT systems. Next slide. Okay, so the agreements themselves. So the agreement must be in writing and be reviewed annually. And training by officers and their supervisors must be completed at least once per fiscal year. So that's important to remember. It's not a one and done as it relates to the agreement or the training. So if you're on a telework agreement, just put it in your calendar. When it's time to renew your agreement, just put that on the calendar so that you can get with your supervisor, reassess your current agreement, and execute a new agreement, as well as ensuring that you both have completed your annual telework training. Now, let's move on to the responsibilities in and around the alternate work site, which in many cases might be an officer's residence. So officers must maintain internet service at the alternate work site and are responsible for any other personal expenses related to telework. So for example, if you were approved to telework from your home, you are responsible for paying the cost of the internet service in order to telework from home. That's not something that the government pays for. Additionally, you're expected to keep the alternate work site free from interruptions, any safety hazards, or dangers. So if in the case of you're teleworking from home, it's important for you as an officer to think about, okay, where in my home could I telework from that would provide a degree of privacy, freedom from interruption, would be safe, and would enable me to effectively telework from that location. That includes internet service if you are using a medium of accessing the internet that may be spotty, depend on where you're located in your home. It's also important to recognize that the government assumes no liability or any injury or damage to property for telework aside from any of the applicable requirements that are found in 21 U.S. Code, Section 3721. So although your home, for example, may be your alternate work site, the federal government does not assume responsibility for things that happen in your home as it relates to your telework, except under very narrow criteria or circumstances. Next slide. So, officer responsibilities. Well, the primary responsibility is that the officer needs to recognize that your ability to telework must be in writing. And so the ultimate authorization for you is the telework agreement, which must be in writing. But your request should be in writing to your supervisor, should be in writing as well. So you can start with an email. Ask your supervisor about the potential to telework. You're also responsible for ensuring that while teleworking, you're engaging in only official duties, and that you continue to adhere to the standards of conduct for executive branch employees. And any supplements to the standards of conduct, as well as any other applicable agency policies or regulations, while at the telework site. So, for example, while you're teleworking, you're on duty at that alternate work site, so it wouldn't be appropriate for you to also be performing outside activities while you're performing your telework duties. So understanding what that looks like really begins with the initial discussions that you have with your supervisor. And so that's the best place to start, to understand what your duties should be from your telework location and what the extent to which you understand your supervisor's expectations for activities that can be performed while you are at your alternate work site. Because the requirement to request leave and the leave-taking processes and policies still apply to you even while you're at your alternate work site. It's also critical that you notify your supervisor of any conditions that may impact your ability to telework. For example, we recently had a situation regarding a member of our team who was teleworking, and that team member received notification that their internet service provider was going to be coming into the neighborhood and there was going to be an outage. And so that was very important information to share with leadership. And so that's a concrete example of a time that if there's going to be an internet outage in your neighborhood and you're working from home, you'd want to make sure you notified your supervisor that could impact your ability to telework. Additionally, officers need to be mindful of the fact that upon reasonable notice, which is generally considered 1 day notice, but that could be subject to further clarification, and encourage you to have that discussion with your supervisor, that you would need to report to your primary duty station when the need arises. And so typically, telework locations are often within the commuting distance to their primary duty station. So important piece for officers to recognize when they are on a telework status. Next slide. So continuing on in officer responsibilities, as I mentioned earlier, just because you're teleworking doesn't mean that leave policies and processes are suspended. You need to continue to follow the leave processes just as if you were at your primary duty station. You're responsible for maintaining a phone line whereby you can be contacted during business hours and be accessible via either telephone or email at all times during business hours, meaning the agreed upon period of time in which you will be considered on duty at your alternate work site. You need to ensure that the safety and the security of all government-furnished equipment that you've been provided to telework from your alternate work site, and any government information that you have access to or you're utilizing at your alternate work site. It's the best practice to ensure that you are when you're at your alternate work site that the information that you're managing and utilizing ideally would stay in electronic form and kept securely on your government furnished equipment. But at times there may be a need that might arise to have paper documentation, to keep notes. And you have to recognize that the same rules and regulations related to government record keeping apply to you at the alternate work site if it falls within the types of information that is covered and considered government information. Additionally, you are liable for any damage to any government-supplied property that you have at your alternate work site. And government-owned equipment is to be used only for authorized purposes. So that's also important, particularly if your alternate work site is at your home. You might have other household members there. They need to understand that the government-furnished equipment is for the sole purpose of conducting your duties at the alternate work site. Next slide. So, how do we complete and submit the telework agreement? Well, as I mentioned, you want to be discussing options. After you've made the formal written request to telework, you want to engage your supervisor and discuss telework options with them. So, will it be regular? And if it will be regular, what will be the frequency? What regularity? What duties will you be performing? If it will be episodic, what are the criteria for you to be performing episodic telework? Whether that be certain activities, it is the criteria in which you would perform episodic telework, or there may be situations that would arise which would require you to perform episodic telework. That should also all be discussed and documented in the agreement. You want to complete the telework agreement form with you and your supervisor, ensuring that all sections are addressed and that it's completely signed, and submit that agreement form to your regional liaison team along with copies of the current telework training certificates. Bearing in mind, current means within the current fiscal year, and we need the certificates for both yourself and your supervisor. You can find a copy of the current telework agreement on the website, the IHS DCPS website under Officer Resources, and I've included the URL for your information in the slide deck. The regional liaison team will complete a review of administrative checks to ensure eligibility and ensure completeness of the form, and will return the approved agreement to the officer signed by the regional liaison so that you can keep a copy for yourself. Your supervisor can have a copy, as well as ensure that you upload the final signed agreement into your EOPF. Thank you for your attention and this opportunity to review telework agreements.
Thank you, Captain Verdugo. For answering your submitted questions, we received one question from last month. Per the teleconference on April 7th, I was hoping someone could expound upon how tribal facilities can become eligible for assignment pay. Specifically, how do tribal facilities report vacancy rates to Commission Corps headquarters? Is there a form or process? How are the original vacancy rates reported from the IHS sites, collected from each site, or data from US.gov? We have had historical vacancies for ages here at the site, so can we retroactively report them now? There was mention on other categories, supervisors, CEOs, etc., in management of clinical providers. When will the data be made available as to which admin positions qualify for assignment pay and at what rate? CPS will be providing a process for tribal facilities to submit the required vacancy rate data to be considered for assignment pay. The data collected will be directly from HR program managers for the vacancy rates or tribal HR program managers. In accordance with Commission Core Instruction 633.06, Assignment Pay, Section 6-2, it states, being assigned to the Indian Health Service, Bureau of Prisons, or Immigration Health and Service Corps, and assigned to a position and location that requires a specific category, profession, specialty, or assigned to a leadership, multidisciplinary position and location that is listed in the Personal Operation Memorandum issued by the Surgeon General. The rates will be identified by your primary category if you are filling a permanent multidisciplinary position. So, for example, our Chief Executive Officer positions at our service units are considered a multidisciplinary position. If the CEO at that service unit is a pharmacist and that site currently has pharmacist as a paid assignment pay category in Appendix A, then that CEO would receive pharmacy pay based upon that multidisciplinary position. We will have more guidance that will be coming out shortly as we are required to submit the updated vacancy rates to Commission Core headquarters by 31 July. Go ahead, next slide, ma'am. All right, so at this time, if you have any questions, please feel free to put them in the chat. Operator, can you please give us the instructions again for anybody who is connected via phone?
Thank you. If you'd like to ask a question, please press *1, unmute your phone, and clearly state your name for question introduction. To retract your question, please press *2. Again, to ask a question, please press *1, unmute your phone, and clearly state your name for question introduction. One moment.
Robin, we have a question in the chat box from Lieutenant Brenda Steger, basically wanting to know the links and where to find the supervisor trainings for telework.
Perfect. Lieutenant Steiger, the telework training can either be submitted through CCLMS or it can be through opm.gov. We will definitely send out a few links that we know of the telework training that officers can take that will meet that requirement for telework.
Our first question comes from Commander Lorenzo Dominguez. Commander, your line is open.
Thank you, sir. I know that you have already responded to half of the question on assignment payment or assignment pay. However, I had submitted my request and it went up to headquarters, and that was retrieved by my CEO and my facility. And my question is, what follows on this? Do I wait until headquarters decides what's going to happen, or I'm just not really sure what it follows next? Thank you.
Thank you, Commander Dominguez. I guess I will take that question. Sir, if you can, what I'd like to do is get offline with you on your very specific situation. That way we can understand and then provide some feedback to you on a way forward, sir.
Certainly.
We have another question in the chat box from Laura, basically asking if a certain immunization is waived with the pregnancy waiver. She has sent a response, a request to medical branch, and I have received a response yet.
This is Commander Frank. I would have to get with medical affairs, so I will reach out to my point of contact there. And so, Laura, if you could just email me your question at dotson.frank@ihs.gov. I can assist you. Thank you.
If you'd like to ask a question, please press star 1, unmute your phone, and clearly state your name for question introduction. One moment.
We have another question in the chat box from Stephen Sherling, asking for officers that were put on an alert status. They're basically asking if there's any indication when that status will be relaxed or changed, impacting their ability to plan and perform IHS work duties.
I will take that question. Hi, Commander Sterling. At this point, I will tell you we have not received any updated guidance from Commission Corps headquarters on changing that alert status for officers. So officers are still all considered on alert. I'm hoping and anticipating that we will get an update soon, and I will refer back to Admiral Calkins' comments is that really in the end, we're all still considered on alert status, and then we just hope and ask for officers to remain ready, but also understanding to be patient, have patience with us and with CCHQ as this target continues to move, and as missions shift, so do the requirements for our officers.
We have another question from the chat box from Seth Green. Excuse me, he's asking guidance on how to submit the weight verification form doing a PHU virtually. Also, if this will be determined from the AAPST, or do I still need to submit a separate weight verification form?
So Commander Green, I'll be honest with you, I don't know the answer to that, and I'll take this question. But what we'll do, sir, is we will research your question, and I'll provide a follow-up response back to you, sir.
We have another question from the chat box from G. Yankee, basically asking guidance on how to figure out if they're considered mission critical.
This is Captain Wansa.
Go ahead, ma'am.
Yes, if you will reach out to your regional liaison, he or she can assist you with an answer to your question on whether you are on the mission critical list that was sent up to Commission Corps headquarters.
We have another question in the chat box from Ramsey Hawalsi. Sorry if I mispronounced that. Basically asking if there's been any guidance on PHU appointments being accepted at a certain facility, Walter Reed.
Captain Halsey, we'll follow up and see if you want to let me know exactly with your PHU appointment at Walter Reed. We'll research your question, sir.
Another question in the chat box from Rob Drulo. There's a mechanism in place for volunteering deployment availability for later on this year to plan ahead for call schedules, etc.
This is Captain Wansa. So the issue is that the operational tempo is constantly changing. The requirements are changing, whether they deploy officers and to where. That's just changing, day by day. So the opportunity to volunteer for future deployments is a little difficult because we don't really know, in RDB, not just Indian Health Service, but RDB does not know where and when officers are going to be needed into the future. So it is volunteering for future deployments for later dates in order to plan ahead is not really a sort of not a practical thing to do at this time due to the constantly changing operational requirements.
I have another question in the chat box from Becca, basically asking if there's anything or any guidance as to in the future regarding deployments and letting the officers know that the deployment has been postponed or canceled.
Sure, I'll go ahead and take that question. So as we know, the process is currently is that CCHQ Readiness and Deployment Branch will send an email notification to an officer, and typically then somebody from the Readiness and Deployment Branch will reach out to the officer to confirm, to make sure that the officer can potentially deploy within the time frame that's identified on the original email notification. What we've experienced probably in the last 4 iterations of deployments is that once that phone call is received by our officers, the follow-up email that specifies the notification to the officer of their dates, location, and that they can reach out to OP or to the travel folks to secure their travel is kind of being delayed, I guess is the best way to put it. The mission sets in RDB are changing so rapidly. So based on that, you did receive the initial deployment notification. You also additionally received the initial phone call. At any point in there, that mission requirement can change. And so it doesn't mean that, you're completely off the deployment. Really in the end, it's stand fast, hold on. We've asked for guidance from Readiness and Deployment Branch to see if there's a more concrete or better way that we can ensure that our officers, if they do receive the initial email notification, subsequently the phone call, and they are not deployed, to see if we can get some sort of communication back to our officers. That way we can advise our officers if they have projected leave or, if they're on standby, essentially in the end over a weekend, and that's most of what's occurred is over weekends, that they can return to the duty site on Monday and just keep an eye on their email should anything occur. I am hoping and anticipating that we in DCPS will get further guidance from Readiness and Deployment that we can share out to our officers. But again, I will reemphasize to our officers, please be patient. As soon as we find out, I will tell you I'm turning around and sending an email out to all officers. So I appreciate it.
If you'd like to ask a question, please press *1, unmute your phone, and clearly state your name for question introduction. One moment.
We have a question from the chat box. Rachel Chino, basically asking about the MOU between the VA and PHS. Do you foresee this MOU becoming a permanent duty station and not just used for practice hours?
I will take that question. Yes, so recently, and I quite literally just read through the Commission Corps Headquarters message that went out to all officers, that currently there is now an MOU in place for officers to obtain their practice hours with the Department of Veterans Affairs. There is a process, there is forms that you have to fill out to request consideration to do your practice hours at the Department of Veterans Affairs. As far as I understand, when it comes to the Department of Veterans Affairs, there are officers assigned to the VA. About 3 years ago, It was a very small cadre of officers that were initially looked at to be placed in the VA to provide clinical services as a commissioned officer to the VA. I am not aware, nor have I seen any updates or information from Commissioned Corps headquarters on the expansion of that program, but it's definitely something that we can go back and ask to see if the intention is maybe to expand that program for other officers to serve in the VA.
We have another question in the chat box from Stephen Sherling regarding the, I'm guessing that's the first assignments or PHERST assignments. It is understanding that those positions, when not deployed, will work for other agencies, IHS, BOP, etc. Do you know how those work assignments will be made? If so, how will IHS areas request PHERST officer support?
Hey, Commander Sherling, this is Robin Davidson. I'll talk to you offline on that question, so maybe I can have a better understanding, sir.
Last question in the chat box from Greg Alt, basically wanting some recommendations and guidance as far as the times that we are in and basically leave, taking leave and planning leave. The duty stations, deployments, prepaid trips, any recommendations or insight?
Hi, Commander Alt. This is Robin Davidson. I guess I will take this question. My best suggestion, and this is purely my suggestion, sir, is that if your leave is going to be in the local area, proceed on your leave. Because we, are an ever-changing environment with these deployments, we really don't know from one day to the next at this point when officers will be called to deploy. So if it's going to be leaving amongst the area, absolutely, still feel free. But make sure that you have a communication method to still check your email, either your primary IHS email, your primary tribal email, or your personal email, whatever you have listed in your self-service deployment section. Whatever email addresses are in there, that's how Commissioned Corps Readiness and Deployment is communicating with officers. If you do have a trip planned outside, and I'll use a perfect example is one of my officers in my region. She is getting married this summer, and she was going to go and go home to her family for her bachelorette party. In the end, she was part of the 237. She was activated, but she was never really initially given that email. I would speak with your supervisor first, get their opinion when it comes to leave. Ultimately, what it comes down to is, will you be able to get back to the duty station to deploy within a reasonable amount of time? Now, I say that to also say this. In the leave policy, it specifically states that if an officer is on personal leave and they are recalled due to deployment, it is the recalling agency that is required to pay the officer's return to the duty station to deploy. So, and this is purely an example, if I said I was going to take leave and go down to Florida, if you are called to deploy, two things. One, if they need you to deploy, yes, they will recall you. If we can avoid and you're at the end of your leave and I'm going to return tomorrow from Florida, there may be the potential that we can ask for your deployment to be delayed by 1 day. Now, I will tell officers, use your best judgment. My own personal recommendation is I would not go to Florida. If I can wait, if I can delay and change my dates for my leave, I would, based on the ever-changing situation that we are experiencing with the unaccompanied children mission. But I would say use your best judgment. If it's going to be local, no issues. If you're going to be going out of state and potentially would take more than a day to return back to your duty station, then I would consider potentially changing that leave. I hope that answers your question, Greg.
I have no additional questions from
Another.
the phone lines.
Oh, sorry, Dexter. We have a question
good.
from Lieutenant Commander Nicole Lawrence, basically asking a medical affairs question on if anyone needs to be informed of anyone for planned sick leave or scheduled surgery.
This is Commander Frank. I'll take that. So yes, first of all, you need to notify minimally your supervisor because you're requesting your sick leave. You don't have to give them everything, but just tell them when you're going to be out and when you expect. Provide them a doctor's note. But then after that conversation, you need to contact medical affairs and make them aware of the situation, and they might have further questions for you and documentation needed as well. That's what you would do. Thanks.
And Commander Frank, to add on to that, for Commander Lawrence's question, ma'am, I would also, if potentially there are going to be limitations due to your surgery, then follow the procedures of asking for a medical waiver, because then that will also put you in place where if there are limitations that need to be identified on a waiver, I would definitely request for the waiver, ma'am.
The last question in the chat box from Melissa De Vera, basically asking if officers have to deploy from their duty station or can they be deployed from where they are on leave?
That is a good question, and Commander De Vera, I will answer it. You will be deployed by your duty station. So if you are on leave, you will be returned to your duty station and you will be deployed from your duty station.
Thank you for that. I'm showing, oh, excuse me, we just got one more question from Spoonmore. Will RDB deploy officers from the road? I think you just answered that, Robin. I'm not very sure. Dexter, do we have any calls on the line?
We have no additional questions on the line.
Okay, I'm not seeing any questions in the chat box at the moment. I will turn it back to you, Captain Burnett.
Sorry about that. Just want to thank everyone again for spending time with us. I hope you found this information valuable today, and we look forward to speaking to you all again on the 7th of July. Everyone's free to drop. Thanks.
This concludes